You are watching this DVD because you're considering breast reconstruction and have shown an interest in QUEST, a clinical trial studying different types of breast reconstruction. But first of all, what exactly are trials and why are they so important? Clinical trials with patients are the only scientific way to find out if one treatment is better than another, in terms of medical benefits, side effects, or quality of life. Many trials compare different drug treatments for cancer by comparing a newer treatment with a standard one. There have been great advances in breast reconstruction over the last 20 years, and we need to find out more about which types of reconstruction women are happiest with. We already know that the cosmetic outcomes are good, but we need to know how patients feel. So depending on which reconstruction surgery you have, the QUEST trial will attempt to reveal what you think about your quality of life and how you feel both at the time of your reconstruction and for the next 5 years. This trial is the first of its kind, as it's looking at what affects you and gives you the opportunity to tell clinicians how you think and feel about yourself after breast reconstruction. Your valuable contribution will give all clinicians the evidence they need to help them advise future patients about what to expect when they have a breast reconstruction, both in the short and long term. All members of the hospital teams will better understand how to offer the best possible aftercare. None of this can happen without women like you. QUEST will compare one breast reconstruction procedure with another, and the surgeons involved in the trial are all experts in both procedures, so the results of either breast reconstruction will be of equally high standard. We know that the two procedures used in QUEST give similar cosmetic results for the reconstructed breast. However, we don't know if one procedure is different from the other in terms of your quality of life, hence the need for a clinical trial. We also need a balance in the way we select our patients for the trial. This means having similar groups undergoing each type of surgery, so that any differences in quality of life are due only to the type of reconstruction received. If patients or doctors choose which type of reconstruction they prefer, we will end up with an unequal balance of women. If one of these groups fared better than the other, it could be because of the type of reconstruction, or it might be because the women are different. We wouldn't be able to say for definite that the treatment affected the quality of life. In QUEST, a computer program will be used to randomly allocate you to one of the two surgical groups. This will ensure that we end up with an equal balance of women in each group, as represented by the mixture of red and blue figures. So, if one group fares better than the other in terms of their quality of life, it has to be because of the type of breast reconstruction they had. QUEST is all about quality of life, how women feel about themselves in the weeks and months following surgery. To be able to come to a useful conclusion about this, it's extremely important that enough women agree to take part. You have been asked to take part in QUEST based on your individual needs and physical suitability. You may benefit from taking part, but if you choose not, it won't affect your care in any way. The two breast reconstructions which are being studied in the QUEST trial both use a flap of muscle plus some tissue from your back, which will be used to rebuild the breast and will be carried out at the same time as your mastectomy. This is how it works. The latissimus dorsi, LD, is one of several muscles in your back, under your shoulder blade, that helps to move your arm backwards and forwards. This muscle, together with some fat and an island of back skin, is moved through a skin tunnel in your armpit to the front of your body to make the new breast. The tissue used for the new breast needs a good blood supply, and the advantage of this method is that the original blood supply can be used. There are many other layers of muscle in the back which can take over the work that the latissimus dorsi muscle used to do. The difference between the two procedures is in the size of the back flap used and whether or not the new breast is created with an implant. If you're allocated to have the back flap method, your new breast will be made entirely from your own back muscle, fat, and more of your back skin to recreate the breast volume. A more natural breast can be achieved, but as more tissue is taken from your back, you will have a larger scar. If you are allocated to have the implant-assisted method, your new breast will be made up of the same muscle but less fat and skin than in the back flap method. You will have a high-quality implant inserted to help create your new breast. An implant gives a good cosmetic look, but is static so that in time it can look different from your other breast and may have to be replaced. However, you will have a smaller back scar. Both these types of breast reconstruction give good cosmetic results according to clinical assessments by surgeons. What we do not know is how patients cope after reconstruction and which procedure leads to a better quality of life.
We don't have any evidence to say we should absolutely do one or the other when we think about what we're trying to give you and women, and that is a good cosmetic result and a good quality of life. We would say that they are equal, but they both have their side effects. It's kind of logical that if you are having to undergo a tissue-only back flap, that we are needing to take more tissue from the back to make the breast, which feels naturally very soft, that we may have a longer back scar because we've taken a bigger island of skin, and that there may be some more back symptoms. But that's not inevitable, and there's no clear evidence that this is a problem in the majority of women. Implants are extremely safe, but we know that in the minority of women there may be some scarring around the implant, and that could cause more of a bit of an implant effect where you may see a bit of an edge of the implant, something that is not absolutely distressing to women, but that they should be aware of. So in a sense there's a balance there. The back scar is smaller and there may be fewer back symptoms, but it's not always the case.
Side effects after reconstruction are often minimal, and we don't really know who will suffer those side effects after the reconstruction, but on the whole most people recover very well. Following the operation, of course, they'd expect to stay in hospital 3 to 4 days after surgery and then go home, and then we would see them back in clinic 1 week, 2 weeks and 3 months after surgery. Most people would expect to get back to some normality, of course, just within a couple of weeks. But going back to work, you're looking at 6 to 8 weeks, and getting back to feeling much better, you're looking at 3 months really.
You'll find lots more information on the recovery from your operation in the patient information sheets that will be given to you. For us, one of the most important aspects of your participation